Brought to you by the medical professionals at Carpal Pain Solutions, developers of the Carpal RX.
Carpal tunnel syndrome affects millions of people every year, and it affects their personal lives and their jobs. To understand the symptoms better, we must first understand the cause of this condition. It's actually a disease that affects an area inside the wrist known as the carpal tunnel. Inside the carpal tunnel, your flexor tendons, here shown in white, are very close to the median nerve, here shown in yellow. The tendons are surrounded by a fluid-filled sheath, here shown in blue. Under certain conditions, like rapid hand movement, that sheath begins to swell and it pushes against the median nerve. And that causes all of the symptoms of carpal tunnel syndrome. Therefore, for any remedy to be effective, it must solve the underlying reason for the swelling, and not just temporarily relieve the pressure caused by the swelling, as surgery does. So what are the symptoms of carpal tunnel syndrome? The most common symptoms affect the hand and/or the fingers, especially the thumb, but not the little finger. These symptoms primarily include pain, numbness, and tingling. Also, these symptoms make it difficult to perform everyday tasks, especially when those tasks involve grasping and dexterity. Often, patients are awakened at night with the feeling that they need to shake out their numb fingers and hand. So what can be done to effectively treat this painful condition? Treating carpal tunnel syndrome should be done using two well-known and effective methods. The first is resting your hand in a splint, especially at night. The second method is to have deep tissue massage on your wrist and forearm. But this isn't your everyday massage. It requires specific motions on your wrist and forearm in order to drain excess fluid buildup from inside the carpal tunnel. It also serves to break up the adhesions around the tendons, which caused the inflammation and fluid buildup in the first place. But to be effective, it must be performed twice daily and for 2 to 4 weeks. But you don't have to visit a therapist every day to get this treatment, because the Carpal RX will do it for you. And if you've heard surgery is the only cure for carpal tunnel syndrome, be aware that studies show most people don't need surgery, but merely the treatments previously mentioned. That's because deep tissue massage acts on the tendons, causing them to lose their inflammation, which is precisely what the Carpal RX does automatically, but surgery does not. The Carpal RX will give you this identical treatment. It comes with a true 100% guarantee because it targets inflammation. The Carpal RX always had and always will have a 60-day risk-free trial, which means if you're not satisfied for any reason whatsoever, you get a full unconditional refund of all of your money, including return shipping costs. If you suffer from carpal tunnel syndrome or wrist tendonitis, you have nothing to lose by trying this remarkable product. Remember, it's the only product backed with a 100% guarantee to permanently and easily get rid of carpal tunnel syndrome, wrist tendonitis, or repetitive strain injury. Learn more at carpalrx.com.